Hi everyone, welcome back to iMumz Ask Me Anything session. Today we have a topic that is very common amongst you, and you've been asking us about handling morning sickness. So, Dr. Meenakshi Sharma, we have a very senior gynecologist from Yamunanagar in Haryana. She has more than 25 years of experience. She is also taught in different universities. So, Dr. Meenakshi is very very excited to talk to you how to handle your morning sickness with a good diet. Like obviously you can take medication and all that if it gets extreme, but then ma'am will tell you what you can do from your end as a dietary change to end these episodes. Over to you, ma'am.
Okay, good evening, everyone. It's a real honor to be with you all, and I hope I can help you in some way or the other. And when we talk about pregnancy and nausea, vomiting, okay, pregnancy is a very, very happy time to be in. But for some ladies, like I can say, me too, have a real nightmare, as in morning sickness and vomiting, which can really trouble us and make our pregnancy really, like, very, very traumatic in the beginning, when you just don't know any other way that than just having nausea, vomiting, throwing up every time, not feeling like eating anything. So that is the time when you are not supposed to say that, okay, when the elders in the home say, this is okay, this has to happen. No, it shouldn't really, like, kind of disturb you and distress you so much that it should interfere with your daily activities. And you do need to see a doctor. But there are a few things each doctor will guide you regarding these. But a few things which you should know is that a proper lifestyle and a modification in your diet can help you a lot. Instead of directly going into the medication part, there is medication, of course, but what all you can do at home. First of all, I always tell my patients that listen to your body signals. Always do what you feel like in the first 3 months. It's all right if you don't feel like getting up and you want to lie down all the time and all. It's okay. You have to work later. You have been working before that. So if these 3 months your body is like not very, in a happy space and wants to rest, don't feel guilty at all. It's okay. And you can rest as much as you want, eat whatever you feel like, not because you should eat this because this is supposed to be good for pregnancy and the baby. Nothing like that. Eat whatever you feel like, because there's no point in eating what others force you to eat just because saying it's good for you and then you throw up immediately. So eat what you feel like and try eating, like, small frequent meals. Eat like every 2 hours, take anything like half a banana, and start your day. Like when you wake up in the morning, don't just get up out and walk out of the bed. Just sit up for in the bed for some time. Keep a dry rusk or a biscuit on your bedside before you sleep. When you get up, don't start your day with liquids. Just start your day with some dry, this like rusk or a biscuit or something. Chew it slowly. Don't like eat it fast. Chew it slowly. Make some body movements, like, a little, and then get up and start your day with a positive note. Like, just be happy. Tell yourself today is going to be a better day if you have been suffering from nausea and all. So then when you wake up in the morning, you start your activities. For your breakfast and all, you can just take a dry toast, like bread, toast your bread, put little jam on it or anything you feel like. Or you can take proteins like eggs or oatmeal or anything. But once again, don't like eat too much. Eat in small meals. Take frequently every 2 hours or so. Take half a banana after some time. Yes, but where liquids are concerned, yes, you must have lot of liquids. But once again, you might say, when I just can't, I throw up every time I have water or something. You must take at least 2 to 2.5 liters of fluids every day, and more so in the form of water also. But what you can do is, I tell my patients that every 1 hour that you are awake, fill one glass of water and sip it slowly over the next 1 hour. So that at least you must be awake for 10 hours in a day. So 1 hour per day, I mean, per glass, and that should be okay. You take one glass in 1 hour and you will be done with your liquids. You keep sipping them slowly. You can take clear juices and all, but don't take carbonated drinks, or don't avoid like tea, coffee and all, because that may just add to your nausea and your gastritis, which is not going to be good for you. Take whatever you feel like, eat whatever you feel like. And even if you throw up, despite your medication, you've seen your doctor, it's okay. Like if you're eating and then throwing up, it's okay, rather than not eating and then suffering, fearing that you might throw up. But of course, yes, you have to go to your doctor and they will help you. And once again, it's not going to be like today you have had 10 vomitings and you go to the doctor and within 2 days it will be no vomiting. It won't be like that. But of course, your nausea episodes will decrease. I mean, the number of hours of nausea, your number of vomitings will decrease. That surely will happen with the medical help. But yes, you have to understand that this is like, a symptom of pregnancy, and sometimes it's a little too much for a few of us. So then we have to go with it, and definitely, slowly and steadily it will go. Mostly after 3 months, it reduces to quite some an extent, but for a few, it has to go on. Like it will like still continue for a few more months, which will be definitely lesser than what it is in the first 3 months. And then, yes, it can be taken care of. And we have to rule out other causes. When you go to a doctor will take a detailed history from you, wherein they have to make sure that it is the nausea and vomiting of pregnancy and not because of any other reason, which could be you're having some other problem, and just because you're pregnant, it's not that you're having nausea and vomiting, it's because of pregnancy. It could be some other cause. You could be having gastroenteritis, you could be having a peptic ulcer, you could be having a urinary tract infection, any other problem you could be having which can lead to nausea and cholecystitis and anything. So the doctor from here will take a detailed history and make sure that this is just a nausea and vomiting of pregnancy. And then there will be a thorough physical examination where once again it will be made sure that there are and the severity of nausea and vomiting would be seen, whether there are signs of dehydration or any other problem. Few investigations might be needed to be done. When you go to a doctor, just feel, it's just nausea and vomiting. Why blood test? Why urine test? Yes, because we have to, make out what is the severity and what kind of treatment is required for a particular patient. So few investigations would be required. Sometimes even an ultrasound is required. Not always, but yes, we have to sometimes, see, because if it is a twin pregnancy, or if it is a, pregnancy problem which is called a molar pregnancy, in that it could be excessive nausea, vomiting, which may not respond to the medication or otherwise, or which may need extra medication or hospitalization or any other comorbidities. And so all these tests are also required. And don't take over the counter medication. Just don't go to the chemist and say ki pregnancy ke nausea vomiting ki medicine de do. Must consult a doctor, and then of course your doctor will guide you regarding anything. And here I am to help you for any queries which you may have. Anasuya, I can't.
Yes.
Yeah, you're not in
I was
video.
muted.
Yeah.
Okay, I'm moving on to our first question.
Yeah.
I am having nausea throughout the day, not only in the morning. So it is at 23 weeks of pregnancy. How to avoid this? Is there any way we can reduce nausea with some food? Like, is there any food item in particular that you would suggest?
First of all, the most important thing is she's already 23 weeks. Has she been having this nausea since beginning, or is this a newly developed nausea?
Ma'am, we'll wait for her to reply in
Yeah,
this.
because at
In this.
23 weeks, if it is a new coming nausea, you cannot just attribute it to pregnancy. We have to rule out many other reasons for it. So 23 weeks, a new nausea, vomiting, we cannot take it lightly and just say it is because of pregnancy.
Okay, ma'am. If she replies, I will let you.
Yeah,
Okay.
yeah,
Yeah, I'll let you know, ma'am.
yeah.
Now, the next question here is Sugandha is 29 weeks pregnant. She says, ma'am, I have started experiencing acidity again. It increases so much that I end up vomiting.
Okay.
What do you
So,
suggest?
so first of all, your dietary changes, Sugandha. You must make sure that you're not taking too spicy food, or don't take things which you think you know yourself whatever is your acidity increases after taking what all. So just avoid those foods. Avoid spicy and oily foods. Like, don't take too many fried things or oily things. I mean, or even your spicy things. Take control of your diet, and then once again, if your nausea, I mean, if your gastritis is troubling you, do go and meet your doctor once to make sure there is no other problem. But yes, protein pump inhibitor medication can be given to you by your doctor. So once, you should go to the doctor and seek guidance regarding your dietary habits. Just make sure that you're not eating too many spicy or too much oily stuff, fried stuff.
Thank you, ma'am. We have one of our users complaining that they take the iron medicine and they tend to vomit.
Yeah, yeah,
Uh,
yeah.
what,
It's very much
what do
there,
you
very much.
suggest for
Lot
this?
of problems. First of all, you see that, that what is your hemoglobin? Is it really required? Do you really need the iron tablet? Because if your hemoglobin is good, then maybe if it is really troubling you, you may not take your iron medication. Just take your, I mean, a good diet, which is rich in iron. Take your bananas, take your apples, pomegranate, take green leafy vegetables and all. Take a good healthy diet, and if iron is really troubling you, you may miss it. But still, if your hemoglobin is less and your doctor says that you need to take your iron, then just, though iron works best on empty stomach, its absorption is the best. But since it causes a lot of gastritis, we tell our patients to take it, like, 1 hour before the lunch or so, so that you're neither empty stomach nor full stomach. So that is how we guide. So try doing that. I hope you're not taking it on an empty stomach. Try taking it, like, about 1.5 hours after your meals. And if by chance you're already doing that, then try taking it, with your meals, because at least whatever absorption will happen, it will be better. I mean, it will help you in some way. And that is all I can say, because iron does cause, or you can change your iron salt. Maybe a particular salt is not suiting you. Just tell your doctor that you're having this problem with your iron. Maybe she can change your salt, and then that should be better for you.
Thank you, ma'am. Ma'am, would you like to speak a little on food aversions? कि उनको कुछ खाने का ही मन नहीं करता है. So, like,
No, no, no.
any
In that case,
suggestions
no,
for
no,
them?
no, 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 no. In that case, they have to see a doctor and take the medication, because food aversion तभी होती है ना जब nausea and vomiting is more. That is why they'll feel aversion to the food, because they are getting the smell and the nausea whenever they, like, smell any food, and any particular food comes in front of them. It's a particular smell you associate with that causes aversion to the food. And that is the reason why you won't feel like eating, because you are having too much nausea all the time. So that is why you have to go to the doctor, who will help you with your nausea. And once your nausea is better, of course you'll eat. How can you not eat at all? Because you need energy, you have to eat. Yeah.
Absolutely, ma'am. Ma'am, the next query is similar to the one I asked just now. It is about water. So, Parul is saying she does not like the taste of water, and
Yeah.
she vomits exactly after drinking water. She's been taking a small piece of ginger to,
Yeah. Ginger is,
change her
yeah,
taste.
yeah,
But is there
yeah.
anything else you want to
No,
suggest?
ginger is very good. But Parul, what I would suggest is better you can put any, water. If you don't feel like taking pure, like clean, clear water, you can add some squash or something. Just add little flavor. We also have vitamin C dispersible tablets. You can just add 1 tablet of that and then make it a drink kind of a thing and sip that. 500 ml, may you can just put 1 tablet and then keep sipping it slowly. Or you can just make a lime juice, like, squeeze a lime, put little sugar and salt, and then keep sipping that, because you have to have water in some way. So you can just like ruabza, you can put any orange squash or anything. So just make it a flavored water and have that. But you must have water, and have it in sips. Don't take it like, don't gulp it down, the half glass or full glass. Just have sip by sip, slowly.
Thank you, ma'am.
Yeah.
Namrata is saying how to deal with constipation. Is there any fruit or vegetable which will help me
Yeah.
handle this situation?
Namrata, constipation is mostly always a dietary and a lifestyle problem, mostly always. So it is really important that you should drink more water, eat high fiber diet, and you must walk a little. These three things are really, really important: water intake and high fiber diet. Fiber comes from, fruits and vegetables, salads, and all. Cooked food won't really give you much fiber. So any kind of fruit, like, take the apple, just clean the apple well, wash it well, so, and then eat it with the peel. And then, your bananas are very good, they will help you. Watermelon, any fruit or any salads are very important. And then water is very important, and then you must walk a little. I'm sure if you will make these changes in your, lifestyle, including water and high fiber diet. I always tell my patients, avoid juice. Fruit juice, like, of course, the ones who are not being able to eat anything, for them it is very good source of energy. But for others, especially the ones who are suffering from constipation, it is always better to have fruits, because I personally believe that a juice is meant for the people who don't have teeth. It's either for the infants or for the old people who can't really chew. For everyone else, there should be fruits, so that we don't lose the goodness of the fiber content of it, and other vitamins and minerals which we are going to get from it. So I'm sure if you include this, it will help you. But other than that, if you're already doing that, then isabgol fiber husk should be good for you. You can take that 2 spoons every night with water, and that should be good for you. But of course, you have to increase your water intake and your fiber intake.
Thank you, ma'am. Ma'am, as our topic says, handling morning sickness. So there are few users saying, I feel nausea in the evening. So is
Of
this the
course, of
same,
course.
or what is
Yes,
with the
yes.
name?
Nausea can have any time. Morning sickness, because it is mostly the patients wake up feeling nauseated and they throw up when they are brushing their teeth, especially, So many will come that I vomit when I brush my teeth. So that is because your gag reflex is also a little, at this stage, exaggerated or aggravated. And so, but otherwise, the nausea can happen any time of the day. Some people have it in the day. And, I've seen that working with working women, it is more so in the evenings, because when you wake up in the morning, you are rushing to your work. You don't even get time to think that you are having any problem. But when you come back from work, then you lie down and realize that I'm having pain, I'm having nausea and all. Of course, it can happen. And your medication will be like, changed accordingly, the timing of the medication. But of course, it can happen.
Uh, Ma'am, so here one of the users, Aksa, she's saying, I feel that acidic vomit in the morning,
Yeah.
like before as soon as I get up.
Yeah.
So,
So yeah, that is
what
because,
is,
when you're lying down, no, I mean, there is a little during pregnancy, because of the hormone progesterone and all, no, your esophageal sphincter, I mean, the cardiac sphincter, that is a little relaxed. And sometimes there can be a little reflux into your esophagus. And when you vomit, all those acidic contents may come out. So, one thing which you can do is that don't take your, dinner too late, and don't lie down immediately after dinner. Try doing that, and then you can keep one or two pillows under your head, or you can just, put your some bricks or something under the head end of your bed, so that your head end is little raised, so that this reflux can be taken care of.
thank you, ma'am. Uh, Moving on to the next query here. Okay, so Zenith is saying, I feel nauseated throughout the day, but it goes away if I eat something like dry amla or anything. So, is that safe?
Yeah,
Would you recommend
yeah,
using it?
yeah. Whatever makes you feel better, it's okay. That's
Thank you,
okay.
ma'am.
Any candy, if you put in your mouth, any kind of candy, if you put in your mouth and it keeps dissolving slowly and it'll keep your taste better, anything which can help you relieve your nausea, it's okay.
Ma'am, you just mentioned, vomiting while brushing. So
Yeah.
Sugandha has messaged, I vomit while brushing, and this has just started during the 27th week. And I'm in the 29th week right now. Is there something to worry about? This was not a
See,
previous
it
episode
could
that she
be.
had.
No, but that's why I'm saying nausea, vomiting happening first time in pregnancy at 27, 28 weeks is not taken lightly. She must go to her doctor, get a full the examination and done, and tell her doctor so that it can't be like nothing should be ignored at this stage. If it was continuing from the early pregnancy and that she's been having one vomiting every day, it's, still it's okay. But first time happening at 27, 28 weeks cannot be ignored.
Thank you, ma'am. Ma'am,
Hmm.
one of the users is asking, is it possible that our diet changes the baby movements? She's 23 weeks pregnant, so ऐसा होता है क्या? If they eat something, baby movements will be more. If they eat something
You see, this is
else,
a very
baby movements will be
perspective.
more.
This is a very perspective feeling. Maybe when you eat something, your baby likes it, and the baby starts moving. Maybe sometimes, your when you're eating a particular thing, your sugar levels go up and all. That may kind of, sometimes the baby may feel sedated after that. Sometimes, I mean, this is not really. There's no scientific study about it. But yes, if the baby feels happy, so be it. Good.
Thank you, ma'am. Ma'am, Shweta is 35 weeks pregnant in the eighth month. She's saying, she's feeling baby movements more, I think, in the last 2, 3 days. Uh, like, does she need to
Shweta,
start packing her bags?
she's still in the eighth month.
Correct.
No, eighth month she shouldn't be packing bags, but because we wouldn't want you to go into preterm labor because the term starts only at 37 weeks. So till 37 weeks, we don't want our patients to come in labor. But you see, movements, is it too much like feeling they at 8 months? See, number of movements should normally remain the same, only that around this eighth month, seventh and the eighth month, they become more strong. They just become very strong, so maybe you perceive them a little more. But any kind of reduced fetal movements or excessive fetal movements should not be taken lightly, and a doctor must be consulted. But if it is like the number is the same but just the strength is more, that's okay. That is perfectly fine.
Thank you, ma'am.
But then
Moving
definitely not the time to pack your bags.
on. Okay.
Yeah.
Ma'am, moving on to the next question by Neha. She's 15 weeks pregnant. She says,
Okay.
Ma'am, I'm feeling very weak if I do any work. I get back pain, legs pain, etc. So, is this normal or is this something I should be worried about?
No, see, feeling so weak is never normal. It could be a variant, like, yes, you could feel like that, but that's not a happy space to be in. So, first of all, ensure your water intake, because sometimes in pregnancy, when you're not eating water, I mean, drinking enough water, like you have dehydration, your muscles also feel dehydrated. So, then you may have weakness and body pains all the time. And what is your hemoglobin level? I hope it is okay. And if not, then I hope you're taking your supplements, your calcium, your vitamin D, your iron. And if any multivitamins have been prescribed to you, I hope you're eating well. I hope you're in a positive state of mind and in a happy space, and you have a good family support. So all these things are very, very important in pregnancy and in feeling good and feeling of well-being. Otherwise, you may feel lethargic or tired all the time, because at 15 weeks, when you're having no nausea, vomiting, you shouldn't be really feeling so weak that, and having body aches, because now starts the golden trimester of the pregnancy, the 3rd to 6th month, when it is, I mean, you feel your best, like. So it's not, I can't say it's normal, but I hope everything is okay with you, your supplements, your dietary intake, and everything.
Ma'am, she also, I see there's one more query from her. I was bleeding. Doctor gave me injections and told me to take Susten 200 tablets till the 8th month. Is it necessary to take only once? I have seen spotting and there was a layer of blood. Now all my scans are normal and I'm taking bed rest. So one is like, does she need to really continue the Susten
See,
tablets? And one more is, can she start physical activities now?
yes, she must start physical activities. It is very, very important to be up and about. There is no role of bed rest with just one spotting in early pregnancy. There's absolutely no role. But yes, when you have acute bleeding, that time we tell you for a day or so. But then, otherwise, other than that, she should continue with her daily activities, and maybe that is the reason. See, now comes the answer why she's feeling so weak, because she's on the bed all the time, psychologically unwell, and the sustain also progesterone sometimes, they kind of cause a little lethargy in the body and all. So sustain which she's taking, but otherwise there's no need absolutely for any bed rest. Yes, she should abstain from intercourse, and other than that, how long she should take it, her doctor would know best, because and I hope it's not a high risk pregnancy. Has she had previous miscarriages? Why her doctor has given her particular medication, I really can't say much about that, because you have to see the whole case in totality before you give your views about anything. But yes, definitely, with one episode of just mild bleeding, she should be doing her daily activities and all, but nothing to the extent that she should feel exhausted. She should like walk. When patients ask how much should I walk in pregnancy, I always tell them, walk as much that in the end you should feel good about yourself, not that you feel so exhausted that you then don't feel like doing anything and you want somebody to press your back and all those things. Just listen to your body and ask you how much you would want to do, and do what like makes you feel good.
Thank you, ma'am. Uh, I have body heat issues. What can I eat to subside it?
See, body heat, like feeling a little warm in pregnancy, is kind of normal. And I mean, are you having fever? Did you check your temperature? And I mean, how many weeks pregnant you are? And regarding food, just see what feels good. You can take your milkshakes, you can take fruits, you can take water, you can take your salads and all. They'll make you feel very good.
Thank you, ma'am. Uh, so here I see a query. In my first trimester, the smell of ginger, garlic triggered nausea in me. So I completely excluded them from my diet. Now I'm 14 weeks pregnant and I'm still reluctant. I think there's one more user. What to do for the heightening of smell for some foods like onion, garlic, milk, rice, etc.
Yeah. See, it does happen in the first few months. It does happen, and sometimes it continues throughout pregnancy. So I'm sure, like, if two, three things are troubling us, avoiding them in pregnancy shouldn't be really a big deal. It's okay. And regarding the query of she's reluctant to include ginger and garlic, if her nausea and vomiting are better, and now if she's not having aversion to that, so then slowly she should include them one by one, not uh, don't include them together. Start including them slowly in your diet and see if you like it. If you don't, then don't.
Mm. Ma'am, one of our users have stopped taking iron and calcium because there's a lot of constipation that she's facing. Is it
Yeah, it could
advised
be.
to do that?
No, it is possible. Some patients may have this problem, definitely. But once again, I'll say that first check with yourself. Ask yourself, are you drinking enough water? Are you taking in enough fiber? And are you, walking? Are you like having an active lifestyle, like as much as permissible in your pregnancy and in your particular case? And then you can just try isabgol or something like, mild this bulk laxative, so that and see if it works for you. And then still, if it's causing you constipation, then you can one day take iron, one day take calcium. Don't take both things together if both are causing you problem, because normally it's the iron which may cause this problem, not really calcium. So just see.
Thank you, ma'am. Uh, the next question I see here is Neha says, I'm 26 weeks and 6 days pregnant and I'm still vomiting. I'm taking Udiliv for liver infection. It has improved, but it is still the burning sensation on my stomach is still there, and I feel a little pukish here and there. Is it okay? Am I doing fine?
See, Udiliv is not given for liver infection in pregnancy. Udiliv, I think, if it is ursodeoxycholic acid, that is given for intrahepatic cholestasis, like obstetric cholestasis, which we call. And in that case, like, and this particular gastritis which is she's having will be taken care by the protein pump inhibitors. And if she's taking UDCA, like Udiliv, so early in pregnancy at 26 weeks, has been told by her doctor. I really don't know what her liver enzymes are and what particular case she is. And her doctor would know best. Really, I can't guide her because she's taking, I mean, it's a liver issue. So everything has to go together. And this is like, she has to be monitored from time to time. But yes, particular like acidity and nausea can be dealt with the protein pump inhibitors. Like,
Thank you, ma'am.
mhm.
Nandini is 9 weeks pregnant. She says, I was prescribed Dufaston 10 mg once daily. Currently, for the past 1 week, I'm feeling so tired and fatigued. Is Dufaston the reason why I'm
Yeah,
feeling like this?
it could be responsible. It could add on to your, like, normally you feel lethargic in the first trimester. Dufiston can add on to it. Yes, it can.
Thank you, ma'am. Ma'am, we mentioned that it is good to have fruits instead of juices. So, GC is 26 weeks pregnant. She's asking, after taking many fruits, my tongue is getting sour. So, what do you suggest in that case?
What kind of fruits are you taking that it's causing your sourness of tongue, or are you eating too much? You see, everything is good in moderation. Excess of everything is bad. So I don't know what particular, fruit you're taking and in what quantity you're taking that your tongue is getting sour. Because fruits like apple, or orange, or banana, they shouldn't really cause you sourness of your tongue. But yes, if it's really, if I mean, if in because of some reason you're not being able to take fruits, then okay, go ahead with your juice. Juices are not contraindicated in pregnancy or at any stage of life. They are not like forbidden. It is just that it is much better to take a full fruit. But never mind, you can go ahead with your juices and enjoy the goodness of fruits.
Thank you, ma'am. Ma'am, one of the users, Sugandha, who had just mentioned that she vomits in the 29th week, she's replied saying, I had really bad nausea and vomiting till 4 months. Second trimester was a little easy, but now from the past 2 weeks, I'm having vomiting while brushing. So, should I still check with my doctor? Is her query.
Yeah, she should still check with her doctor. Maybe it is the simple nausea, vomiting of pregnancy coming back, but yes, she has to check with her doctor to rule out any kind of infection which may be there, to check with her blood pressures and other, liver enzymes, or whatever the doctor may feel after a thorough history and a examination. Whatever investigations they feel, and then take whatever your doctor guides you. Just don't take it on your own.
Thank you, ma'am. To all the users who have been posting about nausea and vomiting, ma'am has explained in detail in the beginning. So, just before we end the session, we will give you some tips in the finger that you can take away. So please don't mind if I'm not taking in the queries because ma'am is constantly answering that. Ma'am, moving on to another question here. Meenu is saying, I'm in the eighth week and have tested for thyroid, and
Okay.
now it is around 2.9. So the doctor suggested thyronorm tablet. Is it advisable to take medications this early in the pregnancy?
No, because if she is already a patient of hypothyroidism and she is taking her medication, then she must continue. She must continue with them throughout her pregnancy, because all your hormones should be like, normal and in the normal range for the proper development of the baby and for your healthy pregnancy to continue.
Thank you, ma'am.
Yeah.
Uh, Tanya is 31 weeks pregnant. She's saying, hi, could you please tell us what to eat in a diet which can increase baby's weight?
So, Tanya, a good healthy diet is really, really important, wherein proteins, carbohydrates, fats all have to be taken. And proteins are like a real important aspect, which most of the vegetarian patients, miss. Because when we usually ask our patients what they are having, it'll be all the time, ki in the breakfast they had parathas, in the lunch they had chapatis or rice, in the dinner they had chapati or rice, and it's all carbs, carbs, carbs all the day. So they will be putting on a lot of weight per se, the baby maybe, but what about the baby's health and your mother's own health? Because after all, her health is not important to us only till she is pregnant. It's also more important now during breastfeeding, because she has to breastfeed the baby, she has to take care of the baby, and she should be in good health herself. So make sure to include proteins in your like, I don't know if you are, I mean, particularly when you're asking for the increase in baby weight, has your baby or ultrasound been diagnosed with a low weight or so, which could be of because of different reasons, not necessarily the diet. There could be placental reasons, there could be like fetal reasons, there could be maternal reasons for it, for the baby not growing too well. But other than that, I mean, there's no real need to increase the baby weight per se, because if your pregnancy is going on healthy, the baby will be of adequate weight. There are so many reasons which determine the baby's weight, like your genetic factors and all. But yes, you must eat healthy, your proteins must be included. If you are a egg eater, you must include at least 2 eggs in your diet every day. Include all these pulses and your beans and all in your diet. Include your like vegetables, salads, fruits, water intake, and then of course carbs and little fats, like like we always tell the patients, even for the ones who are having complaining of constipation also, that include a little ghee in your diet, if it is not contraindicated because of any other issue, like too much calories have been restricted for you. Otherwise, 1 spoon of ghee in the food really won't hurt. And believe me, all your mothers and mother-in-laws will be very happy when you put a spoon of ghee over your dal, and it works well. It gives you the good fats also. So just take this diet and include fruits and include like salads and proteins, carbs and fats in your diet, and water. It will be very good for you. But do include proteins. And if for all those viewers who are not who are vegetarians and don't eat even eggs or so, then there are powders, protein X powders are there, or Threptin biscuits and all. So you must take that, and also take all these pulses and all kinds of dals and rajmas and all, soya. Take soya, tofu and all in your diet. It's a must. Milk
Thank
also, milk and yogurt, very, very important.
Okay. Ma'am, you just mentioned milk, so I'll take in a question that is related to milk. Jyoti is 9 weeks pregnant. She's saying, I have been advised to drink milk twice a day, due to which I feel bloated. Please suggest the best time to drink milk, or if she should avoid it.
Jyoti, if it's really not suiting you, no problem if you don't have it for 2, 3 weeks. It's perfectly fine. But try taking, milk in any form. Like you can take in a banana shake, take in any kind of a shake. You can make it strawberry shake or something. Or then take, if still you're not feeling too good about milk, there's no particular time per se for taking milk. Take it whenever you want, like whenever you can include it in your diet. But if by chance it really is not suiting you, you can try yogurt. Try taking yogurt, like at any time of the day with your meals or in between meals as a snack. Make it a Greek yogurt, a fruit yogurt, or any other thing. You can do that. Or make a kheer for yourself, make a custard for yourself. Milk in any form you can take, no problem. If you're feeling bloated, you just change the form of milk for some time. Unmute yourself, Anusua. Unmute yourself.
So sorry, so sorry. Bhuvana is 5 weeks pregnant. She's saying, I don't have any symptoms of nausea or cramps. Do I need to worry? I had previous miscarriages, so I'm like a little
how,
worried because of that.
how many weeks you said she is?
5 weeks.
5 weeks? No, no, 5 weeks. Don't just feel positive and feel happy. God is very kind. Your pregnancy will go well. But yes, if you've had a previous miscarriage, then just go to your doctor and get your scan done at around 6 weeks plus or so, just to check with the baby's heartbeat and the growth, and feel happy about it. You don't need to feel the cramps. That is not a good sign. And nausea, 5 weeks, be happy as it hasn't started as yet. Don't worry, be happy and stay positive. All will be well.
Thank you, ma'am. Anna is saying, I never had acidity issues earlier. Now, suddenly, I daily have acidity and burping after I have become pregnant. I cannot eat anything immediately post getting up, as I have to take thyroid medicine. So, you had suggested take something in the morning. So, what do you suggest in her case? It remains throughout the day.
In her particular case, because she has thyroid issue, I'll always say that keep your thyroid medication with you on your bedside, with a glass filled with water. And whenever, like, you wake up in the morning around, say, 4ish, 5ish, whenever she just takes a turn, and if she has wakes up for even few seconds, she should take in the medication, so that once she finally gets up, her thyroid medication is done with, and then she can start her day with something like a biscuit or something. And then she should get up from the bed, like, and then, of course, if it is she's having too much morning problem, her doctor will prescribe her the medication to be taken at bedtime, so that they are effective till morning.
Thank you, ma'am. We are getting a few food related queries. First one is, ma'am, can I take raw turmeric? Some people are saying it causes miscarriage. The other query is, can I take raw mango because it reduces my nausea?
Yeah.
And the third one is, can I eat fresh mango, pulp, basically
Papaya.
amras? Or, yeah.
Amras,
Uh,
yeah. Mango is not a problem at all, but I always tell everybody everything in moderation is okay. Nothing in excess is good, No food in excess is good, and anything in moderation is fine. So, where the raw turmeric is concerned, it depends how much is she going to use. A little bit won't harm at all, but yes, excess of turmeric is not considered good in pregnancy, and because it leads to like little bleeding tendencies. And then this raw mango shouldn't be a problem, but once again, it is like how much you're eating. It's okay, like if a small piece she's having 2-3 times in a day, just to curb her nausea and all, it's okay. And mangoes, yes, you can eat 2 mangoes a day, no problem. One for lunch, one for dinner. Have.
Thank you,
Yeah.
ma'am.
Yeah.
Uh, Ma'am, you mentioned that it is important to stay active and exercise and all that. So Akula is in the 8th month. She's saying, can you suggest me which time is the best for doing exercise and how much exercise should be done?
What time is recommended? Whenever you feel like, that is the time for like exercise. The best form of exercise in pregnancy is walking, And yes, there are a few particular exercises which you may ask your doctor to guide you regarding, towards the end of 8th month and so, wherein, squatting and everything is like really good for you and all. And in your particular case, I don't know your full case, whether you've had any issues with, antenatal period or so, but walking is never going to harm anybody in any way. And then what time, any time of the day, and how much, I already answered this query, as much as what would make you feel happy or feel good about your body at the end, not making you feeling exhausted by the time you finish with your exercise.
Thank you, ma'am. Uh, Ma'am, is it okay to eat hajmola to change the taste in case they are having a lot of nausea and vomiting?
See, there is no harm in eating it, but not too much because it has lot of salt. Hajmola has like, lot of salt in it. So it's not too good to take so much salt. It can cause water retention and all. But yeah, one tablet or so in a day or one or two in a day is okay, but not too much. Not that you should be having it one after the other.
Thank you, ma'am. Anshu is 8 weeks pregnant. She's saying, I feel very sleepy around 12 noon. And once I sleep, it is so difficult for me to wake up. And I feel weak. I don't get up until I feel hungry. What to do?
Anshu, please sleep as much as you want to sleep. This is the only time when you can pamper yourself. Once your baby is born, your sleep, your waking up, everything is going to be around the baby. The baby is going to dictate to you. So, if it's okay with you and you have help and you are not working, please pamper yourself and sleep as much. And never mind if you don't feel like getting up. It's perfectly fine. But yes, once again, I'll say drink water so that it's not that you're getting dehydrated. Keep eating after every 2 hours so that you're not hypoglycemic and all. Just eat well and keep sleeping. No problem.
Thank you, ma'am. Vijaya is 21 weeks pregnant with twins. So she's saying, I'm not able to eat as much as I have to eat more foods for both kids. Please suggest what to do.
No, no, this is a very wrong notion where you say now you have to eat for two. There is no need to eat for two. You are still one unit. Just eat healthy and eat as much as you want. Like, don't pamper yourself, don't overeat also. But yes, if you are gaining adequate weight and you're feeling well, if you're feeling well, which means you're healthy, if you're like carrying on your routine work and you're feeling good about yourself, it's fine, it's perfectly fine. Not necessarily that if you're having two chapatis before pregnancy, now just because you're pregnant you need to eat three. No, nothing like that. You just need to eat healthy. You just need to include, as I told you, few good things in your diet, in which we can make it a healthy balanced diet. Just eat healthy, stop eating junk if you're eating, and just eat healthy and adequately. Overeating is not required in pregnancy, definitely not required.
Thank you, ma'am. Lata is 7 weeks pregnant. She's saying, is it safe to cycle short distance or would you only recommend walking?
No, 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 she can cycle. She can cycle, no problem.
Thank you, ma'am. Uh, Jyoti is asking, does thyroid have any impact on the baby since she has thyroid?
No, if your thyroid is controlled, then don't worry about the baby or the pregnancy. Only thing is it should be controlled. That is all.
Thank you, ma'am. Uh, Next query is Monica says, ma'am, I'm bloating all the time. Is there any advice for me?
Bloating, just take care, Monica. Whatever makes you feel bloated, just avoid that. And I really don't know how many weeks pregnant you are. I wish you had mentioned that. And if you're feeling bloated after any particular food or something, or are you taking any medication already for
Ma'am,
it?
she's 14 weeks pregnant.
Okay, 14 weeks pregnant she is. Then yes, if you were having nausea and vomiting and gastritis or I mean because of your pregnancy, you could feel bloated for that. But yes, you can see whatever, food, just keep trying and, eliminating few foods or adding newer foods to see what is like, what suits you better and what makes you feel good. Other than that, you can consult your doctor. They might give you a few medication for gastritis so that you feel definitely better.
Ma'am,
And try eating small frequent meals again, I will say.
Ma'am, Varsha says, I'm 30 weeks pregnant. I feel less baby movements of the baby, mostly in the night, I feel. What
Is
shall
she
I do to increase it?
is she working?
Uh, she has not mentioned that. She's saying,
Because
plus I'm
this
having back pain, and in the morning, I wake up with leg cramps. So,
that's what
Varsha, could you write in the chat if you are working?
because this problem comes with, once again, working women or the women who are doing all their household activities themselves, are very busy in the daytime. So what happens is that they are like, so busy in the daytime that they forget to perceive the fetal movements, and when they lie at the night, they then realize, oh, did I feel in the daytime? Oh, now I'm feeling the movements, perhaps I never felt them in the daytime. So that could be a big confusion in them, in the women who are like really busy in the daytime. Then other thing which she said, backache, once again, because you've been working in the daytime all the time. So when you lie down, you just feel that now you then start feeling your aches and pains. Where her cramps are concerned, very important that she's taking in enough water and electrolytes in the day, make sure of your dietary habits and all. And then a very important thing which I would tell all the working women, who keep sitting throughout, even the ones who have their desk job might feel that I've been sitting the whole day, why I'm having leg cramps or something. It's really important that your circulation should be good. So whenever you are sitting, make sure to get up from your chair every 1 hour. So that is why I guide the patients that if you will, drink one glass of water every 1 hour while at work, you will definitely need to use the washroom, after every 1 minute. So you'll compulsorily get up. Even if you get up and go till the walk till the washroom and come back should be good. Even if you don't have to go there, just get up from your chair, go around your chair and sit again. Just 2 minutes, stretch your back and your all. Because otherwise, by the end of the day, you have so much pain in your lower back and you have so much pain with your legs hanging all the time. So and always keep a little footstool under your feet when you're sitting so that your legs are not all the time, your feet are hanging, which may also lead to edema and a lot of pain in the legs and your lower back. So make sure you're not sitting, continuously for very long hours. You're drinking enough water and your posture should also be good, which can, a faulty posture could be a very, very important reason for a backache at this stage. But yes, as the pregnancy grows, because of the muscle strain, because of the growing belly and your spine, coming under strain of the muscles and all, this pain is important. I mean, it could be like many of us could be suffering, but once again, if we are adopting a proper posture, there are a few maternity, belts and all which help you keep your posture and in place. And then if you're doing a few exercises, you're taking your vitamin D and your calcium supplements, if there is any, like, of course, which is important. And if your hemoglobin and all is okay, you have no constipation and a good diet, I think it can be taken care of. And local, gels and all, they work. Somebody can give you a little massage there. So these all things work. And regarding the leg cramps, so once again, she should take care of, she should take in, like, if she's not a hypertensive, she can take it, the lemon water with salt and little sugar 2 to 3 times in a day. She can take that. And so that her electrolytes are not disturbed. And then there are magnesium tablets also which help you with the cramps, and calcium, I hope calcium and vitamin D she's taking.
Thank you, ma'am.
Hmm.
Since we are discussing diet, Anusha is 26, is 16 weeks pregnant. She says, "Ma'am, I have gestational diabetes. I'm taking 10 units of insulin every day. Is it okay to have jackfruit and mango in moderation, or should I avoid it completely?"
You see, basically, when there is gestational diabetes, I'm sure, and you are on insulin, how many weeks is she?
15 weeks pregnant, ma'am.
15 weeks. So 15 weeks we wouldn't call it gestational diabetes. It would be a pre-diabetic or a diabetic per se, because gestational diabetes happens only later in pregnancy. So this is too early, 15 weeks. So if she's taking 10 units of insulin, I'm sure she's maintaining her blood sugar profile, which her doctor must have told her, wherein fasting and post meals or pre meal, according to whatever her doctor endocrinologist has explained it to her. See, the whole issue is your total calorie intake you have to monitor. I mean, you take care of, and your sugar levels you have to monitor. If someday you want to have your mango and go less with some other carbs or other sugars, so that your sugars are taken care of, it's perfectly fine. You can have them. The only thing is we ask the diabetics to decrease, I mean, take less sugar, because then it's the purest form of increasing your sugar spike. The glucose will spike up and it'll give you more calories, and which may not be too healthy. That is why. But once in a while you're pregnant, if you feel like eating a mango, it's perfectly fine. You can, once in a while definitely eat it, but make sure your sugar levels are controlled.
Thank you, ma'am. Ma'am, Farzana is 9 weeks pregnant. She's saying, apart from nausea, I'm also having running nose and throat trouble. Could you please suggest a remedy for this?
Is she having just in these days, or if she's having a continuous allergic kind of a problem? That is
No,
important. Huh.
she's saying since few days.
Since few days, it could be because of the change of weather and because of the seasonal variations, I mean, or some allergies per se. She can, just take in a spoon of honey, and she can take in steam, and she should drink warm water, do saline gargles, and take warm fluids, more warm fluids, and take steam twice a day. She'll feel better.
Thank you, ma'am. Ma'am, we are getting a few queries. My pregnancy is not complicated. The scans are normal. Still, my doctor is asking me to take Sustain or do Feston. Is it important and should I continue it? So I see
See,
one or two queries here.
See, I know, I can understand the patient's dilemma, but I hope you will understand mine also. I am really nobody to comment on it as to why your doctor gave them to you at the first place, and for how long she has asked you to continue. Please respect your doctor's view. And if you are nervous about something, take in a second opinion. You have every right to do so. But sitting here, not knowing your full case in totality, I'm really nobody to comment or guide you whether you should continue taking them or stop taking them.
Thank you, ma'am. Ma'am, Deepika is 12 weeks pregnant and she's saying, I'm only taking folic acid. Is it necessary to take any other supplements since I'm vegetarian as well?
Yeah, now onwards, Deepika, your doctor will start you from the 13 weeks onwards. Your doctor will start you on iron, on calcium, and vitamin D. And yes, as I told, you must take high protein diet. Include soya, tofu, and all in your diet. Include green leafy vegetables. Include dals and your beans in your diet. And do add your Protein X powder in your milk or in any form. Just increase, add proteins to your diet, and take your iron, calcium, and your vitamin D.
Thank you, ma'am. This is another dilemma that our users have. I crave to eat hotel food sometimes. I'm working and I don't have help at home, so sometimes I'm too tired to cook food. I am also having vomiting and nausea most of the time. Is it safe to eat outside food?
Yes, you can eat outside food, but just make sure it is cooked food. Don't eat raw food. Don't eat salads from outside. Don't eat raitas and all, because you just don't know what kind of water has been added. See, basically, when we ask you not to eat out, basically we want to avoid any kind of gastroenteritis, any kind of infection, or any if liquids you're drinking some water from outside, any infection in the water, any jaundice or any typhoid or anything. But if you are very sure about the hygiene level of the particular place where you are going to order in from, and make sure it's a cooked food. it's a cooked food and it should be fresh. Then no harm in eating from outside, but just don't eat from any, like, place where there is dust and all, where the hygiene levels are not good. And never eat uncooked food from outside.
Thank you, ma'am. Ma'am, along with pregnancy, there come a lot of dietary restrictions. So Monica is saying, my elders tell me not to eat grapes, brinjal, bitter gourd, urad dal. We've also got queries about having raw papaya, about
Yeah.
pineapple.
See,
So, is it okay to eat in moderation, or
see
how is
raw
it?
raw papaya and pineapple. Of course, I once again will say that anything in moderation is okay, but raw papaya could be avoided in the first 3 months, for a simple reason that it may cause contractions of the uterus, which may increase the risk of miscarriage. And then, even, like, there is a particular enzyme in the papaya which may lead to, once again, softening of the cervix and all. But once again, if you have one or two slices of, papaya, the ripe one, it shouldn't be a problem. And that also, not every day you're going to have. No, once in a while it's perfectly fine. Raw papaya, do avoid in the first 3 months. Where other urad dal and all those bitter gourd and everything is concerned, nothing has any, like, we don't say no to anything. No, we don't say no to anything, like. But yes, anything in moderation is never going to harm you.
Thank you so much, ma'am. We will not keep you any longer, but the users who've been waiting for your tips, if you can just give some tips to them on your fingertips, saying, this is what you should be
Okay.
doing for nausea and vomiting. Yeah.
Number one, stay happy. Very important. Number two, rest well. Rest as much as your body demands and as much as your routine can allow. Number three, eat healthy and eat whatever you feel like eating. Just don't eat what others force you to. Don't have milk because you're supposed to have milk. If you don't feel like having milk and you throw up after that, have yogurt, have in any other form, have custard, have kheer, have a milkshake or anything. You're not okay with warm milk or anything, okay. Number four, lot of, like, liquids you should have, but in sips, to prevent nausea and vomiting. Number five, healthy meals in small, frequent meals. In small, frequent, meals should be had, and healthy eating should be there. And yes, do walk, change your environment at times. Change in environment can work well for you. And family support is very important, yes. And just get up, get ready. The day you're feeling worse, get up, get ready, and go out for a walk. You'll definitely feel better, because the more you'll sulk, it's very important to get up and take a bath. I had a patient once who, I was, because they were family friends, I went to see her. Her room was stinking. She was stinking because she hadn't taken a bath for the last 5 days, because she said, I'm just not feeling well. So that makes you feel even worse. So you're supposed to, feel fresh all the time. You have to feel good about yourself. You have to tell that this is okay, this will pass off, and medications will help me. Go to your doctor whenever you feel like. Feeling unwell is never normal in pregnancy. Nothing is like this is normal. No, this is not normal. Little bit is okay, but if anything is really troubling you, please go and seek help, and feel good about yourself. You're going to have a very beautiful, experience. Make your pregnancy happy and healthy, and enjoy your pregnancy.
Thank you so much, ma'am. Our users are very, very grateful for everything, all the insights you've shared, and I'm sure it will add value to their pregnancy. So, we have a lot of users and a lot of queries still pending. So, to all the users whose queries we couldn't take up, ma'am has tried to answer as much as she could in this 1 hour. But if it is pending, please do feel free to post it on our feed section. One of our experts will revert within 24 hours. And as ma'am said, please continue staying healthy and happy. Continue meditating, go for a walk, join our live yoga sessions that will make you energized every alternate day. Follow the diet section, and just, keep connected with your baby. I think that will make you happy. So thank you, ma'am, for joining us, and we were very, very happy to have you with us, and we look forward to having more sessions with you.
Thank you, Anusua. Thank you so much. And I hope I was helpful to the patients in some way.
Oh, absolutely, ma'am.
Thank you.
Thank you.
Thank you.